Okay, we will start. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande from Pune, Maharashtra State, would like to welcome you all in this Prasuti Tantra Stri roga classes. Today, we are discussing, of course, the paper 1. Last few lectures are regarding the paper 1. And paper 1 is of Prasuti Tantra, pregnancy and delivery and post-delivery, etc. Okay. And paper 2 is about the gynecological problems as such. I have explained these things to you. Now, today we are talking about Garbhodak or the amniotic fluid. So please open your notebook, write down in the serial number. Don't forget to write down the date. Today is the 31st of October 2023. And the contents are, first is Ayurvedic word, that is Garbhodak. And similarly, it's in the modern obstetrics. It is called as a amniotic fluid. This is very important topic for the examination point of view and also for the practice. Lot of questions have already been asked. We will discuss about the origin, volume, composition, appearance. Just wait. And the most important topic will be functions. So I request here, next topic you write down functions of amniotic fluid. Please wait, write down. Functions of amniotic fluid. These are extremely important. You have to learn by heart. Path karun takaychi sagi lakshana. Okay. Then more important is the next terms, that is, if it is a amniotic fluid is less, that is called as oligo. And when it is more, it is called as a poly. Poly means more. Okay. So these topics are main of today. Then what will be happen if it is a excess or less, and how to manage all these things. Then we are going to see another important topic, that is Ulba. This is Ayurvedic word. Please write down. I am taking little pause, little breathing. Ulba. In Devanagari script also you can write, which is called in the modern obstetrics, that is Vernix Caseosa. Vernix Caseosa. Ulba. Many short notes are there regarding describe Ulba. What is Ulba? Or only Ulba, SAQ, 3 marks. So don't forget this topic. This is very, very important topics. And then lastly, we can talk little bit about Garbha Vikriti Vijnana. What can be the abnormalities in the fetus? What are the causes and what type of this? Teratology. 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 Teratology is a science, and terato means abnormal. In the inside, in the uterus, baby, they have some abnormalities, that is called as a teratology. Logy means science. I think 3 words you have been written: Garbhodak or the amniotic fluid, then Garbha Vikriti Vijnana, Garbha Vikriti Vijnana, and in between Ulba or Vernix Caseosa. So these minimum things we will cover. If the time permits, we will go ahead. Now, as usual, I will mark that particular content and you can focus on that content. But each and every sentence is not important here. Let us see what is important and what is not important. Concentrate. Garbhodaka, here. Cursor, you see the cursor. Amniotic fluid. What is the amniotic fluid? That is the fluid surrounding the baby in the Garbhashaya, in the uterus, during the 9 months. Whole 9 months, are not exactly whole 9 months, some months afterwards, after 2-3 months, it is covered by some fluid. Okay. And there is also placenta. You know, we have learned little about placenta. That is a in between connection of the mother and the fetus. And there is umbilical cord also. So in the fetus, around the fetus, there is an amniotic fluid. Okay. Within the amniotic sac, the sac is a bag. Sac is a bag. So there is an amniotic sac. In the amniotic sac, there is amniotic fluid, and the baby is swimming. Baby is swimming. Baby is swimming in the amniotic fluid. And where is amniotic fluid? It is in the amniotic sac. SAC. Sac is a bag. This is also called as liquor. Liquor means liquid. Liquor is not alcohol. Liquor, amni. Liquor amni, or it is also called as amniotic fluid. It is not a static fluid. That means is like not your dam, water dam. Once it is filled permanently, it is not like that. It is replaced every 3 hours. Old matter is gone, new matter is coming. So fluid is always replaced every after 3 hours. Write down that number, 3 hours. Okay. How that amniotic fluid is formed? Who is forming amniotic fluid? That fluid, somebody should form that fluid, no? So mother's contribution. Mother is giving transudate from maternal plasma. You know, plasma and the cells. Blood is always having liquid part, that is called as a plasma, and cells, red blood cell, WBC, white platelets. So mother's blood, the plasma is coming out from the capillaries, that is transudate. That forms the amniotic fluid. This is from the mother side. Fetal contribution, that baby, secretion from amniotic epithelium, from the sac, transudate across the umbilical cord, because you know umbilical cord contains arteries, veins, etc. That blood is also coming from that walls. Okay. And feto-placental circulation, and also fetal urine is also there at 12 weeks, that is 3 months. Tracheobronchial secretion from the fetus, respiratory tract, tracheobronchial secretion and saliva of the baby, diffusion through the fetal skin up to the 20th week, 5th month. Till 5th month, some diffusion is coming from the skin also. So together, from mother is giving some transudates, and fetus is also giving some transudates from the various things. And that's why this particular fluid is formed. Next. Now we will talk about quantity. This is quantity. If possible, some things you can write down. Okay. So 10 weeks. 10 weeks, that is approximately 2.5 months. After in the pregnancy, in the fetus, in the baby, after completing 2.5 months, that is the quantity is 30 ml only. 12 weeks, 3 months. 50 ml, gradually increasing. 20 weeks, 5 months, you can write down month, that is 400 ml. And then 9 months, full term baby. Complete 9 months. How much? 800 to 1000 ml. That means in some babies, it may be 800, some may be 850, some may be 900. So there is a variation. 800 is also normal, 1000 is also normal. So that is ml. During the last week of pregnancy, the volume again little bit decreases and coming down to 100 to 600 ml. But that is 43 weeks. Remember this. Next, we will go composition. What are the things there are in the amniotic fluid? How that amniotic is not only water. Water is maximum. You can see 98 to 99% water. So when the examiner will ask you, what is the content of amniotic fluid? First answer, water. It is water. It is water, 99%. And remaining 1%, little bit lipid, fats, protein. Don't remember these figures. Don't remember. Only remember these names. Fat, protein, glucose. Glucose is a carbohydrate. Creatinine, urea, uric acid, and hormones. Cortisone, then hydroxycorticoid. 1 or 2 remember. Forget. Other thing, forget. But mainly you remember it is water. Amniotic fluid is water. Amniotic fluid is water. Okay? Next. Now, what is the normal appearance and what is the abnormal appearance? How it look like amniotic fluid? Okay? Pale straw and slightly turbid. This is normal. Pale straw. Straw is a dried grass. Dried grass. Little bit yellowish color. And slightly turbid. That means solid. It's normal. Turbidity is because of, you write down this thing, Vernix Caseosa. Vernix Caseosa. You repeat 100 times. This is very important. Ulba. Vernix Caseosa. Examiner oral, 100% these questions will be asked. What is Ulba? What is Vernix Caseosa? So that is Turbidity is because of the Vernix Caseosa. I am going to explain what is Vernix Caseosa. It is related with the baby's skin. Okay. Then greenish, little bit not good. That is because of the meconium. She sandas, shit of the baby. Meconium indicates fetal distress. That means baby is not comfortable, is in trouble, Huh? Indicates fetal distress. Golden yellow due to the bilirubin indicates fetal cell hemolysis. The RBCs are breaking, and then bilirubin is coming from the RBCs. RH incompatibility. That is positive, RH positive and RH negative. This is a separate topic, but this was there in the first year BMS in Kriya Sharira subject. Please, my dear friend, open. If you have the Dr. Deshpande's Kriya Sharir book from Amazon, English version, open the chapter of blood group and you will get the understanding what is RH incompatibility. Okay, this is a separate topic, separate question is also asked. So we will discuss it some. It is not matching RH positive and RH negative. This is the type of blood group. Okay, you know the A blood group, B blood group, O blood group. My blood group is O positive. What is positive? That is RH positive. We will discuss it. Next, greenish yellow. That is post maturity. 9 month, 9 day, still pregnancy is going on. Then it becomes greenish yellow. Dark maroon due to the altered blood in accidental hemorrhage. If there is a trauma to the uterus, to the mother, then that can affect to the inside amniotic fluid. Prune juice, retained dead fetus. Oh my God! If the baby is dying, already had died in the uterus, it is called as an intrauterine death. IUD, please write down. Mruta Garbha, intrauterine death. That is then given the amniotic fluid changes. That becomes prune juice. Then fresh blood stain. That is because of the low lying placenta. Placenta is at the bottom of the mother's that vaginal part. It's coming down, more down. That is called as the low lying placenta. So this is in general pathological. First is only normal. Okay, we will go further. Then this is the most important, very IMP. Functions of amniotic fluid asked many times in the examination of paper 1. So you have to पाठ करायचं है, याद रखना है आपको. 10 है सिर्फ. SAQ मिल जाएगा आपको 5 मार्क 7 मार्क full marks मिल जाएंगे. First function is a thermoregulation. Thermo means temperature. That amniotic fluid maintains even temperature where in around the baby and prevents the dehydration. Baby is swimming. I am telling you, baby is swimming. Baby is swimming in the amniotic fluid. So there will not be any dehydration and proper temperature will be maintained, not too much heat. Second, most important, shock absorber. Even if that pregnant woman falls down, even if that pregnant woman while driving accident falls down, baby will be safe. Baby can be safe. Why? Because of the bag. Amniotic sac, amniotic fluid. Amniotic sac, that is bag. Amniotic sac, amniotic fluid. Amniotic sac, amniotic fluid is like a shock absorber. Prevents the hazard, damage to the fetus. Third function, bacterial action. Protects the fetus from infections. Next, prevents adhesion between amnion and fetal parts. Adhesion. On contact together with the organs and the amniotic sac. Then provides a medium for free movement. I have already explained you, swimming. Baby is swimming in the amniotic fluid. That is medium for free movement. If it is a solidified, no movement. That is bad. So, helps the musculoskeletal development of the fetus. As there is a lot of space, there is a scope for the development in all the direction. Musculoskeletal means muscles and bones development. Promotes the surfactant synthesis. Surfactant is related with the lungs. It's related with the lungs, and it's a typical covering to protect the lungs. Okay, that is called as a surfactant. Next, promotes the growth and development of lungs of the baby, of course, the baby, not mother, and gastrointestinal tract. This will develop when there is a good nourishment and protection with amniotic fluid and amniotic sac. Now, provides the adequate expansion spread, thus ensures proper placental and fetal circulation. So everything will be nice when there is a big space and like a swimming tank or swimming pool. I personally given the name at this lecture that baby's swimming pool. Tell me. So baby's swimming pool is amniotic sac and amniotic fluid. Okay. During the labor delivery, it forms a bag of membranes that is called as a four waters, ensuring best natural dilator of cervix. First, when the baby 9 months, 9 days, the baby is coming towards the vagina at the mouth of the uterus, cervix and then vagina. Head is engaged. And then first that bag ruptures because of the contraction. Labor pain. Labor pain. In Marathi we call it as a kalayana. Balantinincha kala, Marathi madhe. That is a delivery, during the period of delivery, the uterine gets contracted, stretch reflex created, and slowly and steadily the baby comes out. But before head comes, that bag, amniotic sac, is burst because of the pressure. And that is called as, please write down this word, four waters. F-O-R-E. Four waters mean the water coming at the time of delivery before the baby's head comes out. It is called as a bag rupture, and that is the most important indication that very soon there will be that is important, that water leaks out first and then slowly the delivery takes place. Okay, I think there is a connection loss, internet connection problem with the Ankit. Okay, we will see, no problem. Now we will go further and we will talk about amniotic fluid index. Amniotic fluid index, AFI, amniotic fluid index. What is that index? Is a quantitative estimation. How much is the fluid of amniotic fluid, an indicator of fetal well-being. That means how much is the fluid and how much is the status of that particular fetus. Is it okay or is it problematic? That is called as a amniotic fluid index. It is like a marker, giving you the idea whether it will be, everything will be all right or there will be some problem, that we can decide. Amniotic fluid index is the score expressed in centimeter given to the amount of amniotic fluid seen on the ultrasonography of a pregnant uterus. When we do the sonography, it can be detected. To determine the AFI, doctors use a 4-quadrant technique. You need not to remember all these things. When the deepest and unobstructed vertical length of each pocket of fluid is measured in each quadrant and then added up to the others, and the so-called single deepest pocket technique. My dear friends, this particular technique, just a moment. Okay, welcome back. Amniotic fluid index we were discussing at this time, and there I mentioned that it is a quantity. How much quantity is the amniotic fluid? During the sonography, it can be decided, but that particular technique, only you remember the name. That radiologist will do everything and give the ready-made report. This much is the amniotic fluid index. That is how much is the quantity. This technique you need not to remember, but remember single deepest pocket technique. Single deepest pocket technique done by the radiologist while doing the sonography. Now, this index is in between 8 to 18 centimeter is considered normal. This value you must remember, 8 to 18 AFI, amniotic fluid index. If it is less than 5 or 6, it is called as a less fluid, Oligohydramnios, less fluid. If it is more than 24 to 25, it is considered as a polyhydramnios. So one is normal. First, 8 to 18. Write down. Please write down in the notebook. Be quick. 8 to 18. Here, I will make a cursor. Normal. 8 to 18, normal. Okay. Then less than 6. You just write down 6. Less than 6, oligo. Write down this. Oligohydramnios. Cursor is there. Oligo. Can you see cursor? Then greater than 24. Greater than 24 is a polyhydramnios. More, abnormal. These two are the abnormal, not normal. First is a normal, 8 to 18. These values are important. You must remember this. We will go further and we will see what is oligohydramnios. Step by step. Don't worry, be happy. I will explain. See, oligohydramnios is less quantity, less. If it is less than 6 or volume, now we also know the volume. Less than 200 ml is called as a oligo, less amniotic fluid. Less amniotic fluid means oligo. Why this is less? Because there may be in the baby, fetus means baby, bilateral renal agenesis, kidney problem. In short, baby's kidney, not mother, baby's kidney problem. And that's why amniotic fluid is less. Placental insufficiency. Placenta is not giving proper nourishment to the fetus, baby. That may be the cause of less fluid. This word is very, very important. Cursor, see the cursor. Please write down. AUGR. AUGR. Intrauterine growth retardation. I will wait. AUGR. Please write down. Cursor is there. Intrauterine growth retardation. Baby's development in the fetus is not good, problematic. Then there may be chromosomal anomalies. You know the genes, chromosomes and genes, you know that. Anomalies. Anomalies means abnormalities. I am not going to tell you everything, but few important things. Polycystic kidney. Again, not mother, baby. Polycystic kidney. Or, now this is about mother. Post-term pregnancy. If the pregnancy moves till the 10th of month, oh my God, not good. That creates the less fluid, amniotic fluid. Now, types and clinical features. Can you see here? Now, these are the two types. Early pregnancy oligohydramnios. Early pregnancy. So here, amputation of the fetal limbs, cutting of the hands and legs, constriction and obstruction of the umbilical cord, pressure deformities, that is club feet, skin is dry, leathery and wrinkled. These are all the clinical features which can be seen by sonography. Are you getting? We have to check the baby, and baby will be having this type of the problems. Bad thing. This is not good. Then late pregnancy oligohydramnios, what will happen? It is a sign of fetal distress, problem in the fetus. Then meconium aspiration. It will meconium will go inside the respiratory tract. Okay. Compression of the umbilical cord and obstruction to the flow of blood, leading to the fetal hypoxia. Marathi मध्ये आम्ही त्यांना गुदमरणे म्हणतो. In English it is called suffocation due to the no oxygen. Hypoxia. Hypo is a less. Oxia means oxygen. So these all we are talking about less amniotic fluid clinical features. What will be there in the fetus? Now we will go further. Polyhydramnios. First we will see what is that and the causes. Now, more accumulation of amniotic fluid. More. When amniotic fluid index is greater than 25 or volume exceeding more than 2000 ml is considered as a poly. Poly means more. This is occurs very rarely, in 1% pregnancy. That means if you in the hospital 100 deliveries are there, in only one lady this will happen. Polyhydramnios. That is diagnosed by sonography. Always remember. What are the causes? There may be diabetes to the mother. Diabetes to the mother. Please write down. I will wait. That is called as, please write down, gestational diabetes. GES. I am talking about this thing. Another word for maternal diabetes. Gestational. GES. TIONAL. Gestational. DM. Please write down DM capital. Diabetes mellitus. Madhumeha. Blood sugar is more. So it is regarding the mother. Then multiple pregnancy. Maybe 1, 2, or 3 fetus are there in the uterus. That is also the problem. Then spina bifida. It is a problem with the spinal cord. Not everything I am reading for you. This is chromosomal problem. Trisomy 18. Okay. So only you remember 2 or 3 things. That's fine. Now we will see the symptoms of the polyhydramnios. Okay. Can you see here? We will see the symptoms. Acute hydramnios, excess, and chronic hydramnios. The liquor, that means that fluid, rapidly accumulates and produces severe symptoms. Acute, very quick, within 1 or 2 or 3 days. Chronic, 15 days, 1 month, 2 months. It occurs in the second trimester. This word is very important. Will you please write down? Trimester. What is trimester? In the pregnancy, you know the 9 month. Okay. So tri means 3. So there are 3 compartments. Please write down. First trimester, that is from 1st month to 3 months. First trimester. Then second trimester from 4th, 5, and 6 months. 4, 5, 6. Write down. Second trimester. 7, 8, 9 months. 7, 8, 9 months. Yes, write down. Third trimester. So first trimester, second trimester, third trimester, 9 months. Okay. So it occurs, this polyhydramnia occurred. Second trimester means 4, 5, 6 before fetal viability. It may result in preterm. Baby will not grow full term. Full term means 9 months, 9 days. Full term. When it is below 7 months or around 7th, 8th month, that is preterm. Pre. And some are post-term. Preterm, post-term. Are you getting quantification? Before 28 weeks, that means before 7 months. Before 7 months. Chronic hydramnios, it occurs between 32 to 40. Can you calculate? 8th month. Okay, and 10th month. In between 8 to 10 months, that is called as a chronic hydramnios. The fluid accumulates gradually. Next, symptoms. Mild polyhydramnios cause, it's okay, no signs, no symptoms. Severe, when there is huge, more amniotic fluid, there will be shortness of the breath to whom? Baby will be problem with the breathlessness, dyspnea. Then swelling in the lower extremities. Now this is for the kindly excuse me. I think this is related more with the mother, because swelling in the lower extremities and abdominal wall, because it is a huge, no? It's like a just for joking, it's like a ascites. You know the ascites, udara vyadhi. That is something different. It is not related with the pregnancy, but it is big. The fluid will be there and the abdomen will be huge of pregnant lady. Okay. So uterine discomfort will be there. Some contractions, pain will be there, and fetal malposition. Fetal will not be in a proper position. Next, we will go further. Okay. Now, complications. Preterm labor. If it is too much, then delivery can occur earlier. Abdominal fetal presentation. Cord presentation, that means umbilical cord will be in the front while delivery. Actually, just now we have seen, first there should be fluid and then head should come. Fetal head should enter first and then shoulders, then this back and then the legs. In this way, actually the delivery comes. But here what is happening? Umbilical cord will become in front. Then cord prolapse. It is not properly coiled. Then uterine inertia. There will not be labor pains. Then amniotic fluid embolism. There may be some clot. Diagnosis. Uterus is larger than expected. Fetal parts are difficult to palpate by the doctor when he is examining to the pregnant lady. No back, no hands, he will not find anything. Fetal heart sounds is not heard clearly. This term is very important. Please write down FHS. Please write down, my dear friends. FHS, very important, is equal to this one. Fetal heart sounds. FHS, fetal heart sound, examined by the doctor's stethoscope, but not diaphragm side, other side, bale part. Remember this, in the oral, we examine the, the stethoscope, lung sounds, heart sound, peristaltic movement, but that we usually, big part is we keep it on the lungs. But here, when you want to hear the fetal heart sounds, another part of that stethoscope, that is a small bale part, it should be kept on the mother's abdomen. Then you can hear that fetal heart sounds, FHS. Okay. Then pregnant ultrasound or ultrasonography is the safest investigation. There is no problem. X-ray cannot be done for the pregnant woman. No X-ray, no X-ray, no MRI. But sonography, safe. Every month you can do the sonography. No problem at all. Large echo-free space between uterine wall, you can forget this thing. But for the diagnosis, you can use the sonography. You can do the blood sugar. You can do the blood groups. You can do the RH factor, this and that. Next. Now, how to treat this problem with the amniotic fluid, Garbhodak, Garbhodak. Mild polyhydramnios, what you can do? Low sodium diet to the pregnant woman, mother, bed rest and mild sedation, tranquilizer. If it is a severe polyhydramnios, then what you can do? This treatment should be given, but induction of labor in case of mature fetus. If you feel that fetus is okay with the sonography, everything has been completed, organs are developed, do the cesarean section. Finish. Then in case of immature, fetus is not properly developed, but normal fetus, actually immature, but what is immature? His lungs are not powerful, heart is not powerful, but that can be saved outside. But then to save that particular child, we have to remove the excessive fluid. That is called as a amniocentesis. I will wait. You have to write down this word, very important. 3 times I will say. See the cursor. Amniocentesis. Oral. They will ask you, what is amniocentesis? Write down, is equal to removal of fluid. Amniocentesis is equal to removal of fluid. Amniocentesis is equal to removal of fluid. Where? When it is polyhydramnios. Don't forget that. We are not removing normal fluid. No. When it is excess, we are taking little fluid out. Not all the fluid. Remember this thing. Okay. If you have any problem, you can just chat, raise your hand. Now, we will discuss this again, SAQ for 3 or 7 marks, very important topic. Ulba or Vernix Caseosa. Please write down this title, Ulba. In Marathi, you can write down Ulba, because in the examination, they will ask you, what is Ulba? Ulba is Ayurvedic terminology and Vernix Caseosa, modern terminology, modern science. What is Ulba? Which covers or envelop the Garbha like a skin. It's just like skin, all everywhere in the body. That means above, it's like a coating, it's like a covering. I will give you the very some funny word. It's not really good word to use, but it's like a lamination. Do you know what is lamination? Any certificate we get, and that is very precious, and we want, or even our license, for example, or PUC, for example, that when we drive the vehicle, we go to that particular shop and we say, do the lamination. So he will say 15 rupees per page. Am I right? Similarly, Ulba is like a lamination, covering to the baby skin everywhere. The Garbha is covered with Ulba and surrounded by Jarayu. Please write down this word, Jarayu placenta, which both provide the protection. This also protect, that is Ulba, and also Jarayu or placenta is also protecting the fetus. Okay. After delivery, Ayurveda has given special advice how to remove that Ulba. How to remove that Ulba? One can remove the Ulba by Sarpi along with Sandhava Lavana. Sarpi is a ghee, Ghee, Ghrita. So we have to apply Sandho and Ghrita together and little application over there, so that automatically that Ulba or Vernix Caseosa will be removed out. Now, Vernix Caseosa start to form during 16 to 20 weeks, from 4th month to the 5th month of intrauterine life. Okay. By the end of intrauterine life, the skin is covered by a whitish substance known as Vernix Caseosa. It is composed of, how it is formed? Secretory products. It's like a secretions from sebaceous glands, degenerated epidermal cells, and hair. Okay. Okay. So we are talking about Ulba, that is similar to Vernix Caseosa. Vernix Caseosa start at the 4th or 5th month of the intrauterine life, baby inside, and then it is continued till the delivery, and at the end of intrauterine life, when the baby is coming out, whole body, whole skin of the baby is covered by whitish substance that is known as a Vernix Caseosa, and it is formed by the secretory products of sebaceous glands, degenerated epidermal cells, and the hairs. It is a mixture of all these things. Vernix Caseosa, what is the function? Protect the skin against the macerating, damaging action of the amniotic fluid, because it is possible that amniotic fluid may damage the skin of the baby, but its skin is covered, laminated, and lamination is Ulba or Vernix Caseosa. It also prevent the overhydration of the skin. Lot of contact of amniotic fluid all the time. So it may be overhydration. That also can be protected. So it is like a waterproof. Ulba or Vernix Caseosa is a lamination which makes the function as a waterproof. Okay, just joking, but similarity you must understand to remember in the brain. Now the last topic of today is a Garbha Vikriti Vijnana. Okay, first slowly we will go for last 5-10 minutes. Okay, just bear with me. Garbha, fetus, baby. Vikriti, abnormal. Vijnana, science. Logi is a science. The intrauterine living organism, intrauterine, in the uterus, living baby is called as Garbha. You know this, Garbha. Any condition which is abnormal is called as a Vikriti. Vikriti means abnormal. The abnormalities which occur during the intrauterine period, 9 months, are termed as Garbha Vikriti. The science about the Garbha Vikriti is known as Garbha Vikriti Vijnana. Okay, this is the definition. Now, Samanya Nidan, causes. Here, Nidan means causes. So you can remember this line more, and some points, not all the points. Bija dosha, that is problem in the spermatozoa, Shukra, or Shonita, that is ovum. Whenever there are problems in the spermatozoa or the ovum, baby can get some problem. That is bija dosha. Bija is a seed. Then Atma karma dosha, Atma, defects due to the deeds of the previous or the present life. You know that Ayurveda believes on the rebirth theory. So when the Atma is having problem, that also causes the problem with the fetus in the uteri. Then Ashaya dosh, Ashaya Garbhashaya. Please write down. Ashaya means Garbhashaya. Defects in the female reproductive organs, especially if there is a problem in the ovary, if there is a problem in the fallopian tube, if it is a problem in the uterus, that can make a problem in the fetus. Kala dosha, that is defect. Kala means time factor. Age of conception. That means if the pregnancy is in a very early stage, at the age of 16, at the age of 17, that can problem with the fetus. If it is after 35, after 40 years, that lady is pregnant, that also can be the problem for the baby, inside baby. Okay. Then ahara vihara janya dosha, defects due to the improper diet and regimen of the mother. Then manasika dosh, defects due to the psychological factors and emotions of the mother, pregnant lady. Garbha dosha, defects due to the planetary position. You know the astrology, Jyotish. That also Ayurveda believes, because that is also a Vedic science. Or Graha is one thing, is a stars and planets, and another thing is the infections. So if there is infection to the mother, that can also affect to the fetus. And anya karanani means other problems apart from this problem. Any other things is called as anya karana, other causative factors. Now, teratology, modern, derived from the Greek word, that is the original Greek word, that is teratos. Teratos, danger, monster. Teratos is equal to monster. Teratos is equal to monster. Or monster means malformation. Mal means bad. Bad, bad, bad. Bad head of the fetus, bad hands, bad heart, bad lung. So organ problem, functional problem, structural problem, that is mal. Mal means bekar. Not good. Then logos, this is logi. Logi is a science. We are studying the bad things in the fetus, that is a teratology. This is the study of malformations occurring in the fetus. The branch of science that deals with the production, development, anatomy, and classification of malformed fetus is called teratology. Even many medicines that can affect the fetus, remember. So it can be the complication of the medicines that mother is taking. So be careful while prescribing the medicines to the pregnant woman. My dear friends, another request for everybody. There is fantastic video on my YouTube channel in the gynecological or Stri roga classes. There is one video, medicines that can be used in the pregnancy and medicines which cannot be prescribed in the 9 months. Very interesting video. For the practice, that is most important. Which things we can give and which things anti-inflammatory drugs, analgesic drugs, antipyretic, which we can give and which we cannot give. Okay, please see that video. Make the notes and send it to me. Okay, next. General causative factors. For example, why these abnormal things happens? Chromosomal aberration. Aberration means again defect, problem. Multifactorial disorders. Too many things have to be considered. Hereditary genetic defects, like for example, bronchial asthma, cardiac problem, obesity. These are the hereditary problems. Defects due to the environmental factors. Too hot, too cold climate, global warming, etc., etc. I think, my dear friends, today it's enough for us, because there is now 8.01 or 8.02. So again, I will revise today in this particular lecture of Stri roga Vijnana or Prasuti roga Tantra. We have discussed about the Garbhodak or the amniotic fluid. We discussed how it is formed, origin. What is the normal quantity? You have seen that is normal. It should be 800 to 1000 ml. If it is too less, that is oligo. If it is too much, that is poly. Composition, 99% there is water. Then pale, straw and slightly turbid is a normal. Turbidity is because of the Vernix Caseosa. Then we have said the function. thermoregulation, shock absorber, bactericidal, killing the bacteria. Bactericidal action prevents the adhesion between amnio and the fetal parts. Prevent the adhesion, prevent, not union, prevent the adhesion. Then helps for the musculoskeletal development, promote the surfactant regarding the lungs, promotes the growth and development of lung and GIT, provide adequate expansion of the fetus. During the labor, it forms a bag of membranes, that is 4 waters for the normal delivery. Then we have seen what is the AFI, that is amniotic fluid index. It should be normal. 8, here you can see 8 to 18 is normal. Less than 6 is oligo, and more than 25. It is not the quantity. This is not ml. This is not ml. Write down. This is centimeter. This is another measurement, AFI. Amniotic fluid index is not the quantity in ml. It is not the quantity in ml. Please write down. But then here we have given both AFI less than 6 and quantity less than 200 ml. Here quantity has been given in ml. Okay, that is oligo. Then we see the causes and the clinical features. Then poly greater than 25, but quantity more than 2000 ml. That also we have seen. Then we have seen the symptoms, complications. Diagnosis is by sonography. Then how to manage it. Low sodium diet if it is a too much water, because sodium absorbs the water. If we eat a lot of salt, it's a hygroscopic. So whenever there is edema, whenever there is hypertension, salt restriction is there. Similarly, in the polyhydramnios, salt restriction. Then we talked about the Ulba or the Vernix Caseosa. This Ulba is Ayurvedic word, Vernix Caseosa is a modern word. Okay, is like a lamination. I have told you that is starting from the 4th to 5th month, and it is secretion of the sebaceous glands and degenerated epithelial cells and hairs, and it protects from the macerating. मराठीमध्ये आम्ही त्याला कुजणं म्हणतो. कुजणं म्हणजे in English it can be called as, I don't remember the exact word, but maceration is a decaying, that is proper word, decaying of the action of the amniotic fluid. It also prevents the overhydration. Then we have talked about Garbha Vikriti Vijnana because of the Bija dosh, then Atma Karma, then Ashaya dosha, Kala dosha, Ahara Viharajanya dosha, Manasika dosha, Garbha dosha. That is modern keratology, chromosomal abnormality, multifactorial, hereditary, genetic, and defects due to the environmental factors. So my dear friends, thank you very much for patience hearing. I wish all the best for your studies. And as this is the evening, I must say to you good evening and take care, and see you tomorrow with the Bala Roga classes. Okay, thank you very much and take care.